Hello, everybody. I am Chelsea Whittington, and I'm back with another amazing interview in honor and observance of Mental Health Awareness Month on behalf of Edgewater Health. I am so excited to talk to this gentleman. First and foremost, we just found out that we share the same last name, but we're not sure that we are related. But welcome, Robert Whittington.
Thank you very much.
Of Edgewater Health. I'm excited to talk to you about your role here at Edgewater. So please introduce yourself, tell us where you're from, and how you ended up here at Edgewater making a difference.
All right. My name is Robert Whittington. I'm a medical assistant and a phlebotomy teacher. I've been a medical assistant for the past 2 years. I'm born and raised in the region, Northwest Indiana. So Edgewater Health was a place that's, close to home, close to the heart.
Yes.
And everything that they do here, not just for, primary health, but for addiction and behavioral, really stands out to what I try to do in healthcare.
Okay.
And take care of the whole patient, not just the disease.
I'm glad to hear you say that, because everyone who has come before you has said the same thing, taking care of the whole patient, which is precisely why we are putting a light or shining a light on Mental Health Awareness Month, because again, taking care of the whole patient means that whomever they see, sometimes we see things that may not necessarily be medically related, that may be mentally related. And thank goodness Edgewater addresses all of those various issues. Now, talk to me about what exactly a medical assistant does.
So a medical assistant is the assistant to the physician. As far as from the second you walk through the door, we're the first people you deal with.
Okay.
From checking in to getting triaged, getting all your vitals, finding out the point of your reason, or the reason of your visit, and seeing if we notice anything else that may be going on. Like you said, patient may be coming in for upset stomach. But if you have known your patient long enough, or you follow what they're doing, you can see that maybe something has changed in their life, something outside that may be causing more stress.
Okay.
Now that can help, the doctors look into, instead of just focusing on the one little symptom, the one little problem, an upset stomach, they can look for other reasons. Maybe you're having an ulcer because you're just under a lot more stress due to a new promotion or losing a family member.
Right.
I mean, everybody's going through something at some point. Everybody's recovering from something, whether it's losing a spouse, losing a job, an addiction. So it's our job to be there for the patient, to give them their education, help them understand why they need to do what they need to do.
Sure.
And to help the doctors also have another set of eyes to see what's going on.
Yes, that's what I was going to say. Tell me, do you recall a time where maybe you noticed something and made a note and said, Doc, what do you think about this?
Actually, I had a patient that came in one time that they just came in for a follow-up, medication refill. But in just triaging them, talking to them, ended up finding out that they were having more issues than anybody knew, as far as at home with their spouse, worried about taking care of their kids, and not knowing where to go to, who to talk to.
Yes.
And wasn't really thinking about going to behavioral health for fear of their children. And at Edgewater, we have programs meant for that, help guide you to the resources that you need, whether it's for rent assistance or housing, transportation, whatever need be.
Yes.
And that's why I always believe in the fact of just talk to your patients.
Yes.
That's, anybody can come in and just say, I just want my meds.
Yeah.
But if you talk to them, you can get them to open up. Actually show them that you care about why they're there, and you'll be amazed at what you can learn.
And I find that that's a common denominator of all the individuals that I meet at Edgewater. Everybody's very, very focused on that bedside manner, if you will, as far as hearing the patient out, not rushing them out the door to find out if there are other things that are going on. What led you into the medical field? What was it that sparked your interest?
I always had a fascination for medicine. Just life had a different path for me until this point. But I grew up with my godfather being one of the oldest doctors in Gary, Indiana for the longest time.
Really?
His office is right here across the street on Fifth Avenue.
Really?
And he helped build the ER department for Methodist, and actually quite a few of our doctors worked with him or worked under him as students back in the day. So that's just always
Yeah,
fascinated me about medicine.
that
and then being
example.
able to talk to people,
Yeah.
get to make that connection with people and make their experience just a little bit better. Because nobody really wants to come to the doctor. You're
Yeah.
feeling under the weather, you're feeling bad. So if you can walk out feeling just that somebody cares, that's what makes it the best for me.
Yes, I'm so excited to be chatting with somebody who might be my cousin by marriage. I don't know, Robert Whittington, medical assistant. Now, I heard you also say something about phlebotomy, so I don't want to bypass that because fluids are important, right?
Yes, they are.
Talk to me about what you do under that realm, phlebotomist.
So as a medical assistant, we are also minor surgical technicians, assisting the doctor in an office, whether it's to remove something and we are also phlebotomists. To be able to draw the blood for your test where you don't have to go off to another lab or anything like that. I also teach the phlebotomy skills at my alma mater where I got my MA from.
Okay.
So that way I can keep giving back. I went to Jeremy College.
Okay, all right. That's always great to shout out your student. And I think that it's especially important to have someone who's doing it actively, teach it as well, so you can give them all those different types of scenarios. And if somebody wants to follow in your footsteps, what do they need to do?
Easiest way is to start looking for programs in the area.
Okay.
I mean, there's Northwest and Indiana Health Academy, there's Jeremy College, Denmark College.
Quite a few around.
There's a lot around, but
What's the
look
commitment?
around and figure out which one fits you the best.
Gotcha, okay.
And commitment is depending on the program. If you go for just the bare minimum CCMA, you can have it done in a matter of 10 weeks.
Okay.
But it's an accelerated program.
Gotcha.
Or you can go for your full registered medical assistant, which is considered the top of the line as high as you can go with it, or as far as medical assisting, and that's a 10-month program.
Okay.
So there's different parts
options.
in it,
Okay.
but you got to be able to have the time and the heart to do it.
And you gotta not be afraid of blood. So I'm sitting here like, yeah, that won't be me. But I am so glad that you have committed your life and your service to the patients that you serve here at Edgewater Health, treating the whole patient, mind, body, everything.
Yes.
So as we talk about Mental Health Awareness Month, what are some of the things that come to mind for you? I know that you see patients from a medical standpoint, but what are things that you would tell your patients and people who would watch this about taking care of our mental health?
Mostly the biggest thing I've ever seen is people feel that they're alone, or that going to get help for something going on means that you're broken, or that you're, the word that we all hate to say, crazy. But you're not. Everybody needs help at some point in time. Like I said, everybody's recovering from something.
Yes.
And I've met people that I've had patients that come in and they lost their mother a year before, and they're still dealing with it, and they're not realizing the effects that it's having on their health because of all the other decisions they're making, not realizing that they're actually destructive decisions. They're actually self-harming without realizing they're self-harming, whether it's spending too much money or just having too much fun and forgetting about your responsibilities, or just having problems focusing or remembering. I know working here was one of the best things for me after losing my mom just a few months ago.
Oh, I'm sorry.
Coming back to here was the best thing I could have done.
Yes.
And getting back to normal and seeing what was going on.
Yeah.
And working with everybody here, allowing me to understand that everybody needs help at some point in time. And don't be afraid to ask for it. That's why we have all these great programs.
Yes.
We have counselors, we have psychiatrists, psychologists, whatever you may need. And even if it's not that, just other kinds of help. That's what we're here for.
Yes. Well, you have made a great impact, I'm sure, with your patients. And now with this video, just letting everybody know that we are not alone, whether it be Mental Health Awareness Month or year-round. The team here at Edgewater is here to help. I have been chatting with Mr. Robert Whittington, and stay tuned. We're going to find out where our family trees potentially cross and I'll report back to my networks. But please share this video and make sure you go and you visit edgewaterhealth.org. Robert, any final parting words regarding mental health or the whole medical industry that you have made such an impact in?
Just that we're always here to help you, whether you realize it or not.
Good enough. Edgewater Health, edgewaterhealth.org. Thank you so much for watching, and we'll see you next time.